All right, I think that's it. Hello, I'm so happy that you're here. I'm so happy you agreed to do this with us.
Thank you, Cara. I'm happy to be here. I'm
Yeah.
excited too.
So I'm going to give a little intro because it's a little bit different than what we usually do on the Facebook group and Instagram and all the things. I'm Cara Maestro. If this is your first time seeing me, I'm the founder of Somastery Therapeutics, and I do 2-month somatic certification trainings. And in the first call of my 2-month cohort, we had an hour and a half of teaching, and then we hang out for the last half hour, and people asked all of these questions about psychedelic facilitation, which is my background, and ketamine became a big topic of conversation. And Mitch Liester is both a really amazing professional in the field. I think you've been working with ketamine professionally for over 30 years, right?
Probably closer to about 10 years clinically. Researching
Clinically,
it
okay.
for longer, yes.
Yeah. And so he's also the father of my fiancé. And I was just curious if he would come on, and he agreed immediately. And I'm so, so, so grateful. So Mitch, do you want to give us a little introduction to you and your work?
Certainly, I'm happy to. So
Yeah.
I'm a clinical psychiatrist. I'm also an assistant clinical professor at the University of Colorado School of Medicine, where I've been working as an assistant clinical professor for, I think, the last 8 years. Before that was a assistant clinical professor at the University of California, Irvine. So I've been practicing psychiatry about 38 years now. And my interest is in altered states of consciousness. Well, one of my interests, one of my primary interests. And so I've been exploring it through a variety of different ways over the last 38, actually longer years. And one of the areas that encompasses is psychedelic medicines. And I've researched and experienced personally and professionally different psychedelic medicines and their therapeutic potentials. And then over the last 20 years or so, became interested in ketamine when some studies came out showing it helped with depression. Initially, that was shown to be effective when people took doses intravenously, but more recently, we've been using very low doses sublingually or under the tongue, and are seeing dramatic results with it in all kinds of conditions. I'm happy to talk about that more.
Yeah, that was one of the reasons that I was so excited to talk to you as opposed to a lot of other professionals in the field, because the layperson knows ketamine either as the drug that they use in ambulances as an anesthetic, or in these clinical settings where you're taking really high doses intravenously. And the work that you're doing sublingually with the lozenges is just so mind blowing to me. And so once I told my students a little bit about it, they were just so excited to ask questions. And one of the first things that I'd love to start out with is, for anybody that's completely new to ketamine, doesn't understand what this medicine is, what it does, can you just give us a brief description of what is ketamine?
Sure. So let me go back to where it started. So ketamine was first synthesized in a laboratory back in the 1960s. Some doctors at a pharmaceutical company called Park-Davis were looking for a new general anesthetic, something to put people to sleep for surgery. And the reason they were looking for a new one is the one they were using previously, called phencyclidine, was causing problems. When people would wake up out of surgery, they'd be very agitated, combative, confused. Well, the other name for phencyclidine is PCP. And so at that time, they were using PCP for general anesthesia, and it wasn't going so well. So they decided they needed to find something different. So these chemists and scientists started looking at analogs or medicines that were similar to PCP but different. And one of them they came up with was ketamine. And they tried it out, and it worked pretty well. There was a little bit of after effects when people wake up from surgery. Some people would feel like they were floating out of their body, or they couldn't feel their arms or legs. And one of the scientists at Park-Davis went home and told his wife about this. And she said, "Oh, it sounds like it's a dissociative anesthetic," which is a label that stuck. Thank goodness, because if it had been labeled as psychedelic back then, it probably would have been taken off the market. But because they didn't call it a psychedelic, it was available and was approved by the FDA in 1970 as a general anesthetic. And so for the last 50 plus years, people have used ketamine both in human medicine and veterinary medicine as an anesthetic to put people or animals to sleep for surgery. And so that was the main use of ketamine from 1970 until about the year 2000, when some researchers at Yale discovered that if they gave lower doses, what they call sub-anesthetic doses, to people intravenously, their depression would rapidly improve. And that was a major breakthrough at the time, because most antidepressants that were in use take weeks to kick in, and so people would be suffering. Mm-hmm. But with this intravenous ketamine, people would feel better within sometimes hours or a day or two. So it was a huge breakthrough. So since 2000, intravenous ketamine clinics have popped up all over the country, helping people who are severely depressed. But there were a few problems with it. It's expensive, first of all, not the medicine, but the time involved. So a lot of people can't afford multiple injections or multiple infusions of ketamine, which makes it difficult. Second, the dose they use does cause a psychedelic-like effect, which some people like and some people don't. So some people don't want to use it. And third, when you stop the IV infusions, the benefits go away. So you have to keep getting infusions or you lose the benefits. So that was helpful for people that were in crisis with depression, but for a lot of other people, it wasn't all that effective. And then about 10 years ago, 11 years ago now, a new report came out of Brazil where some doctors were using very low doses of ketamine, 10 milligrams, and giving it under the tongue. And they would give it to people every 2 to 7 days, and they found their depression improved. So this was a real breakthrough because it was lower doses, lower side effects, cheaper, and very effective. So that was when I first heard about sublingual ketamine, read an article that said it worked. Now, the other thing that's interesting about this that I didn't know about is ketamine is also a natural product. Just a few years ago, I heard actually from your fiance, my son Jordan, that ketamine occurs in nature. And I said, no, Jordan, it's synthesized in the lab. He said, no, Dad, it occurs in nature. I said, send me the study. Well, he did. Turns out some researchers in Brazil, again, were looking for a natural medicine to treat parasites. And they found a mold called Chlamydospora dysphoria. I can't remember the name, but a long name, a fungus that kills parasites. They took it back to the lab, analyzed it, see what it was producing. It turns out it was producing ketamine. So ketamine occurs naturally, and it works to kill parasites by anesthetizing them. So it's interesting. It's both a synthesized drug and a natural medicine. So that got my interest going. So about a little over a year ago, maybe 2 years ago, I started looking into using sublingual ketamine with my patients, and found a colleague in town who'd been doing it for a few years already, Dr. Rachel Wilkinson, and she was having dramatic results with it. So I said, can I kind of learn from you and try it with my patients? In the beginning, she told me she had almost 200 patients taking it. I thought, wow, that's a lot of patients. I wonder why she has so many patients on it. And so I started using it very cautiously in the beginning, and then I started seeing the results. And I saw people getting better, not just with depression, with anxiety, PTSD, OCD, ADHD, eating disorder, substance use. It just kept going. In fact, we just got a paper published today about a case report of it where ketamine worked for a woman with borderline personality disorder and treatment-resistant depression. She's doing wonderfully. So we're seeing more and more benefits. That really got me excited. And so now we're using it. And now I think I have close to 200 patients taking it because it's working so well for so many people. And Kara, one thing I have to mention so we don't get in trouble is that it is not yet FDA approved as a treatment for these other conditions. It's called off-label use, but legally we can do that. If there's a medicine that's approved by the FDA for one indication, there's scientific evidence showing it works for other indications, we can use it, and that's what we're doing.
Yeah.
So that's a quick background on ketamine.
Oh my gosh, this is so exciting. And just for people that don't know, borderline personality disorder is one that a lot of clinicians, when they're getting into their practice, are really afraid to work with because it's very complex, is what I know. And so the fact that there is a treatment that has like even shown that it could potentially be useful for treating that is, I'm sure, going to be just such a breakthrough. So there's, oh my God, there's so many places we can go from there. Where I'm inspired to go, though, is somebody wrote a question that I thought was really interesting, which is there any pre-screening that's done for things like mineral imbalances, vitamin deficiencies, parasites, or anything like that before you begin ketamine? Because you mentioned that ketamine was found naturally and was being used to treat parasites. So is there anything you want to say on that?
Yes, it really depends on the physician who's prescribing it. It varies widely. I know that in Coral Springs now, I'm aware of 7 different healthcare providers that are prescribing ketamine. There are also providers in sublingual ketamine, low dose. Also providers now in Denver and Arizona that we've talked with who are using it. And it really depends on the provider. Some do thorough screens, some don't do much screening at all. So it's very provider specific.
Yeah. And you don't find a lot of Western medicine practitioners that are also interested in like looking for parasites or things like that before they begin prescribing.
Only functional medicine providers, maybe.
Yeah. Functional medicine and Eastern medicine providers, which is lovely.
Right.
If you guys on my channels want to do a talk about parasites, I know a ton about it, would love to chat about it. But so ketamine there's so many different ways to take ketamine and to administer ketamine. It's being used medically and ceremonially and recreationally. You can use it through a powder by insufflation, patches, which I found out a while ago, lozenges like you do in your practice, intravenously, intramuscularly. I wanted to chat with you because I wanted to know more about the sublingual ketamine, but do you want to give us a background about what you're treating with it professionally or anything? I don't want to like press you to ask about any personal use or anything like that or experiences that you've had. But anything that you want to mention about your professional work with the lozenges or your personal experience with it?
Sure. So I can tell you quite a few things about it. So as you mentioned, there's many different ways of administering ketamine. And Western medicine is predominantly used intravenously, occasionally intramuscularly, not very often orally. It can be, or intranasally. But that's because most physicians just aren't aware of it yet. I mean, even when we talk with colleagues, most of them have never heard of sublingual ketamine. They don't want to use it. They're very cautious because they just aren't familiar with it. Although it is being used not only as a general anesthetic, there are quite a few doctors now using it to manage pain as well. And sometimes they'll use sublingual troches, we call them. The difference, one of the differences between these different routes of administration is how much actually gets into the bloodstream. So for example, and that's a term called bioavailability in medicine. So if you get it intravenously, 100% gets in your bloodstream. But if you take it under the tongue, only about 29 or 30% gets in your bloodstream. The rest of it either is broken down before it gets absorbed or is swallowed and it's broken down in other ways. So different routes of administration give you different levels. So if you were to take 25 milligrams intravenously, it would be a very different effect than 25 milligrams under the tongue. So that's an important point. And that's one of the advantages of the low dose under the tongue is even though you're taking low dose, you're getting even less of that into your bloodstream. So again, there's a lower risk of side effects. So as long as it's effective, people don't need high doses. In terms of use, I have to tell you, I have 4 children. 2 of my 4 kids are taking ketamine now through their doctor, a functional medicine provider, one for ADHD and one for OCD, and they're both having wonderful results with it. They're finding, my daughter says that she's able to learn easier. She can read books again for the first time in years because she can focus and concentrate. My son, not your fiance, my other son, has had OCD for years where he would compulsively tear his fingernails off. It started after an accident when he lost a thumbnail, and he started subconsciously, compulsively tearing his fingernails. And after he got on ketamine, he now has fingernails for the first time in years, and other symptoms of OCD are improving. And this mimics what I'm seeing in my practice too, that people with OCD are improving, ADHD are improving. And again, we're seeing so many results, not just in psychiatric conditions, but also neurologic. We're seeing people with peripheral neuropathy are telling me they're just getting better. They don't have symptoms. I had a gentleman with tinnitus or ringing in the ears and loss of smell and taste after COVID for 7 months. And he told me after he got on the ketamine, his tinnitus went away and his smell and taste started returning. My sister,
fascinating.
I know. Well, I got to tell you one more fascinating one. So my younger sister has a pain. She had a pain condition called CRPS. It's a chronic pain disorder that ketamine intravenously has been shown to be effective for. So her doctor started her on some sublingual ketamine to see if it would help. What she didn't expect is a different benefit too, and that is that she was in a car accident 30 years ago where she was rear-ended at a stoplight. And she sustained a whiplash injury and a nerve damage in her left arm. Her left ulnar nerve was damaged, which meant her 2 fingers, her pinky finger and a ring finger, were numb and paralyzed. Basically, she couldn't feel them for the last 30 years. And once she went on the ketamine, suddenly she can now feel those fingers for the first time in 30 years. I mean, we didn't expect that. She didn't expect it, but we're just seeing neurologic improvement too. And at some point, if you want, I can try to explain how that works.
Well, I think that's a really great place to go because the people that are in my network, all of my work centers around the nervous system. And there's so many examples and studies about how when you regulate the nervous system and are able to get that survival energy to move from the body, then you see all crazy kinds of symptoms that should be not associated begin to go away. And everything from stomach issues, leaky gut, migraines, fibromyalgia, and all sorts of physical, mental, like crazy stuff. So do you think that these things are disappearing because of its work in helping to regulate the nervous system?
Yes. So some examples of that would be, for example, the case report that we just published today about the patient with borderline personality disorder and treatment-resistant depression who's doing so well. She also emphasized and wanted me to tell people, she gave me permission to talk about her situation. She also suffered with chronic fibromyalgia, which is gone now. And she says she believes it's because she's better able to regulate her emotions. And I think that's probably true. So I think the improved emotional regulation that we're seeing, even in people with bipolar disorder and borderline personality disorder, is because of an improved neurologic functioning. And one of the things that we've learned recently about ketamine that we didn't used to know, we knew that it could be an anesthetic, it could reduce pain, it could help with depression, but it also has what are called neuroplastic effects, which means it can alter our nervous system. And there are studies showing that it can produce the growth of new nerve cells in the brain, that's called neurogenesis, new connections between nerves, which are called synapses, and that's called synaptogenesis, or the creation of new synapses. There are studies in mice showing it can even replace the insulation on nerves called myelin, remyelinate damaged neurons, which has implications for multiple sclerosis. And one of the most exciting things, Kyra, is that we're also looking at the possibility it could be turning on something called silent synapses. So some researchers discovered years ago that as many as a third of the connections or synapses in our brain may be silent, which means they're dormant or sleeping, they're not working. And it's because they're lacking one particular protein called an AMPA receptor. For some reason, these nerve connections don't have it. It looks like ketamine stimulates the production of those AMPA receptors and may turn on those silent synapses, which is really exciting. And that may help explain some of the additional benefits we're seeing way beyond the improvement in pathology and diseases, but actually enhanced cognition, improved learning, improved memory.
Yeah, absolutely.
It's fascinating. Yeah. So we're just excited to see the potential as more people learn about it and start exploring it more.
It's so exciting because there's there's a lot of pushback as a somatic facilitator, as somebody that works with the nervous system, for people that have things like tinnitus or muscle pain or injury pain from an accident that just don't have any interest in even considering that potentially this could be emotionally related. And as we really learn more about the fascia, like the fascia is so new to being studied as far as a system of the body, but they're realizing that the fascia is a way of, some people are theorizing, and there's some great research to back that the fascia system is actually just a different type of nerve cells. And so the fact that ketamine can have this like neurogenesis effect is potentially the reason that these kinds of physical injuries are able to loosen. And one of the things that I wanted to say here is that in my practice with it, I was using ketamine and body work in conjunction. And what I would see is that I actually worked on a person who he ran an EMT training school. And of course, in ambulances, ketamine is one of the things that they use to anesthetize people because it has very little medical contraindication, and it's pretty safe to give people even if they don't know what drugs they might be on. And he had administered it for many, many, many years, had taught many people how to administer it, never taken it himself, and had all kinds of issues, had broken his neck, I think twice. And there's just a lot of injury. And as we're working on him, he said it so beautifully. He was like, it's almost like I can feel my psyche's grip on my body release. It's like the emotional holding of the body begins to release with ketamine. And so I'm really excited to begin to see more studies of ketamine being utilized in conjunction with movement and fascial stretching or yoga. But I digress. I just wanted to geek out on that for a second because we have so many questions for you.
Well, can I make a comment about that real quick?
Yeah, absolutely.
So you bring up an interesting topic too, and that's the whole role of cellular memory, which again, in Western medicine is not very well understood or accepted yet. Although there's enormous research showing the cellular memory exists at multiple levels. And it looks like the ketamine may be affecting or have the potential to affect cellular memory in ways that nobody's even considered, looking at things like epigenetic memory or cellular memory, looking at alterations in RNA levels. There's so many things we could talk about here. We don't have enough time, but yes, I'm very excited about what you're talking about because I think the combination of somatic work with something like ketamine has the potential to move the treatments far ahead of where we are now, far ahead.
Yeah. Oh my God, so exciting. Okay, so with the peripheral neuropathy and nerve disorders, Parkinson's within your practice, can you tell us a little bit about the results that you're getting?
Sure. So these were unexpected benefits. And thank goodness I have very self-aware patients who are very good at monitoring their symptoms and are very open and reporting. So the first time I heard about this was a lady who came in who's been depressed for years and years and years. And we put her on the ketamine because she didn't respond to conventional antidepressants. And she came in after being on ketamine for a short period of time, a month or two, and said, "Oh, Dr. Liester, I'm feeling so much better." And then at the end of the appointment, as she's getting ready to leave, she said, "Oh, and by the way, my peripheral neuropathy pain isn't so bad." And I said, "What do you mean?" She said, "Well, I've had peripheral neuropathy for years, and where it was at a 7 or 8 out of 10 before, now it's like about a 1 or 2 out of 10. I said, "You're kidding." I just filed that away thinking, well, I don't know if that's related to ketamine or not, but it's weird. And then a second patient said, "Dr. Liester, my peripheral neuropathy pain's better." And now I think I've had 7 patients just volunteer without me even asking, "Oh, by the way, not only is my depression better, but my peripheral neuropathy pain is better as well." We don't know the mechanism yet, but it's fascinating to think about how this might be healing damaged neurons. And so we're starting to look at it. One of my colleagues wants to start using it in patients who have chemotherapy-induced peripheral neuropathy to see if it will help, a neurologist. And I have another friend who treats
while they're on chemo or after, or both?
Potentially during and after, because ketamine is starting to be looked at as a potential treatment for what are called neurodegenerative diseases, things like Parkinson's disease, ALS, Lou Gehrig's disease. even dementia. And I have to tell you, my colleague, Dr. Wilkinson, is telling me it takes a long time, like maybe 9, 12 months, but she's starting to see people with dementia starting to have some reversal of their symptoms. And so she's having some really pretty major results. And we're hoping to publish some more of these results to get more people aware of this and interested in researching it.
Do you have any idea if ketamine changes the brainwave frequency, like how often your brain is sending signals? Do you have any idea about that?
It's a great question. I don't know. I haven't read anything about that, but it's an interesting idea. It'd be a relatively simple thing to study.
Yeah, we'll just tell Jordan too. He's really good at finding those studies.
Okay, that works.
Okay, so what can you tell me about, let me see this. Oh my God, there's so many good questions here. Actually, can you just go into a little bit more about the Parkinsons and I have to sneeze, what you've seen in your work with that?
Yes. So, bless you. So that was one of the first things I looked at because I have several patients that have Parkinson's, and so we wondered if it would help. It's difficult to tell. At this point, there are studies showing that definitely it can help with something called dyskinesia, which can be a side effect of some of the Parkinson's medicines. One of the common medicines that they use for Parkinson's is called carbidopa-levodopa, which is a mixture of dopamine-related chemicals that helps sometimes reduce Parkinson's symptoms, but it causes people to have involuntary movements that are uncomfortable. And there were studies showing that intravenous ketamine helps with that. So we started using a sublingual, and several of my patients have told me that it seems to be helping with the dyskinesias. We don't know if it's slowing down the progression of Parkinson's. I haven't seen reversal yet. I also, though, do have a patient with ALS who we started on ketamine just to see if it would help. And his progression has been much, much slower than was expected. Now, that there's one complicating factor, and that was at the same time we started ketamine, he enrolled in a clinical trial with a new investigational treatment. So we don't know, is his slowing of progression due to the ketamine, the clinical trial, or both? And unfortunately, they just happen to coincide at the same time, so it's going to be hard to tell. We're hoping that it may help with ALS as well. And I do have a couple of patients now with Alzheimer's or dementia that we started on ketamine. We just don't have enough time on it yet to know if it's going to help them or not.
Yeah, that would be so exciting as a treatment for dementia. Okay, so I'm going to read a question here directly that Jess asked. She says, I'm curious if patients, oh no, wait, this is not the one I wanted. Sorry. Here it is. Yeah, can we explain the mechanisms at work in the body when used? So if I were to paraphrase this, what are the mechanisms of action in the body? What happens in the body, brain, gut when you take a sublingual dose of ketamine?
Ooh, that's a great question. And I think we've just scratched the surface with it. I think it works at multiple levels. For example, I've talked about some of the neurologic change, the neuroplastic changes already. We started looking at another mechanism. It also looks like ketamine does affect the microbiome. One of the things we want to understand is, does ketamine affect the microbiome in such a way that it enhances learning? And it looks like it does. So we're working with Dr. Margaret Harris at UCCS, who's a microbiome expert. And we've started doing research already and hope to put out a paper looking at the effects of ketamine on the gut microbiome, how that influences through the vagus nerve, the brain, in terms of enhanced learning. So that's still very new, and nobody's really looked at this yet. So
well, it would make a lot of sense if the ketamine that was naturally found in the fungus was being used to treat parasites, because a lot of the treatment for parasites is actually just like getting your immune system a little bit healthier and helping the gut microbiome balance, which all can be helped by emotional stability and like a felt sense of safety in the nervous system, regulating the nervous system. And so it all kind of works together like that. It wouldn't surprise me if it were helpful.
Well, that's because you have a holistic view of things.
Everything is clearly together.
Yes. Unfortunately, in medicine, we become very siloed. We look at one part of the body and forget that it's connected with the rest of the body. And the more we can integrate these, we can see multiple interconnections. So I think, yes, I think the gut microbiome is key to some of the benefits of ketamine, both in terms of potentially reducing parasitic. When we talk about parasites, again, people mean different things by that. My training was, when we talk about parasites, we look at big things like Giardia. But there some in indigenous cultures, they may also consider bacteria or viruses as parasites. They're parasitic on our system.
Yeah.
And so I think we need to open our minds a little bit in Western medicine to consider different kinds of parasitic infections too, that ketamine and other medicines may help us with.
There's a really, I also have like shamanic training as well, and have just done enough like research in that kind of realm of medicine to understand that a lot of times, parasites, yes, they can be bacteria, they can be worms, they can be, lots of places in the body. They can be in the blood, the gut, the brain, the sinuses, the whatever. And there's tons of tiny little organisms that can like live off of other organisms. Not all of them are harmful, but they can also be in, shamanistic training. They're also linked to often emotional parasitic activity. Like if you,
Yes.
I love this thought where a lot of people that work with DMT or plant medicines will talk about entities or demons or things like that, which are, it's kind of understood that they're things that latch onto you. And instead, I love the training that I was given, and it feels really true to me that it's like a thought that you think and then you keep thinking, and then it starts to just like think itself and it
Right.
gets a mind of its own. And this in and of itself can be like a parasitic thing. It's draining energy from the system and wants to keep itself alive. And so when you begin to try to evolve out of a thought form or a behavioral pattern, it feels really like you're going to die because part of your psyche is actually being drank by this parasitic thing. And so a lot of times with parasitic issues, even if they are legitimate, bloodborne, gut parasitic issues, they can be greatly helped by these personality and emotional shifts. And then your body starts purging things. That's why ayahuasca is known to kind of help parasitic issues as well. Right?
Absolutely. Oh, I'm so glad you brought that up for a couple of reasons. Yes. So,
Yeah.
again, from a shamanic perspective, things can be viewed differently. We don't necessarily look at molecules, we might look at energy. And parasitic energy can be negative energy or bad energy. And ayahuasca, one of its uses, as you know well, is to eliminate parasites in the body, both physical, emotional, and energetic parasites. It's interesting to me, there's some research going on at UC Davis in California. David Olson is a PhD there who's looking at psychedelics and their effects on the nervous system primarily. And what he's found is, well, first he's come up with a new name. He calls these medicines psychoplastogens, which is a long word. But he said these are medicines that stimulate the nervous system to grow and repair. And interestingly enough, ketamine is the prototype, but he's found that other medicines that do the same thing are things like ayahuasca, MDMA, psilocybin, peyote, ibogaine. So it's interesting that these psychedelic medicines that people have really focused on their consciousness altering effects have other effects as well on our nervous system, for example. And I think with ketamine as the prototype, we can look at its effects at so many different levels. We can look at its effects on the nervous system or the microbiome, but we can also look, as you're suggesting, on its effects on parasites, whether they be energetic parasites. And what are the energetic effects of ketamine? Nobody's looking at that yet, to my knowledge, and I think that would be fascinating to explore.
I am. I was like, it's my main, like you, it's just the passion for altered states of consciousness, whatever those be, whether you access them through breath work or meditation or medicines or sex or food or fasting or like whatever it is. There's all sorts of ways to alter the consciousness and how that changes how you're working emotionally and mentally, and then how it changes the effects that are happening physically on our bodies or with mental disorders. I can't stop thinking about how amazing it is that was potentially a treatment for tinnitus, because the veteran community, that's one of the main things that they struggle with. And it has an association with trauma, I know from studying somatics. So yeah, this is just incredible. I want to get to some more of these questions too. What is the ideal candidate for ketamine as it stands in the medical field right now?
Okay, that's a great question because it's expanding rapidly. Initially, like I said, it was people for anesthesia or for pain management. And then in psychiatry, we're using it primarily for depression, but that has expanded so much now. And the nice thing about it is we have not found any problems with it interacting with other medicines, as you talked about. So in psychiatry, if I have someone that comes in with depression or OCD or bipolar disorder, it also does not trigger mania. A lot of the conventional antidepressants, if you put someone with bipolar disorder on them, it can trigger a manic episode, which is not good. Ketamine is not doing that. It's stabilizing mood. So we're seeing the ideal candidate list expanding rapidly to include most psychiatric conditions we're looking at as potentially benefiting. And one of the theories behind that, Kyra, is that, when I was in medical school, we were taught that psychiatric disorders are caused by chemical imbalances. That was a very narrow view, which probably isn't even, it's probably a very small slice of the pie. It's a partial explanation. But now more and more, we're looking at neuroinflammation, inflammation in the brain, and how that contributes. And one of the fascinating things about ketamine, another mechanism it has, it also is an anti-inflammatory. medicine. It reduces inflammation in the
Mm-hmm.
brain. And so by reducing inflammation, that leads to the potential to help a lot of different people with a lot of different conditions.
Mm-hmm.
So it's hard to define the ideal candidate for this, because almost anybody's an ideal candidate who has not just any psychiatric diagnosis, but many neurologic diagnoses. And even we're starting to see, I've had reports of people with on the autism spectrum disorder improving with ketamine. Traumatic
Mm-hmm.
brain injury, I have a patient with traumatic brain injury that was improving. Post-stroke. So it's hard to define it because it's expanding so
Yeah.
rapidly.
And I would say that, my understanding of that, because everything relates back to somatics in my world, is just that when you regulate the nervous system and give the body a felt sense of safety, everything begins to repair itself. Like, our bodies are meant to repair themselves. And so we
Yes.
can support the things and eliminate the things that are keeping our body from doing that anyway, which is so often stress or unhelpful belief systems that are causing that stress, that are causing that inflammation, that are causing the seizing of the muscles, all the things. And it's just it's all together in the nervous system for me.
Yeah, yes, Kyra. And what I would love to see happen with some of your followers, the people that you work with, is
Hmm.
to begin integrating ketamine into somatic therapy.
Yes.
I think it has enormous, enormous
Hmm.
potential to help people, much more so than either one alone can do, because you're
Yeah.
working with different levels then, and you're, as you talked about earlier, releasing some of the fascial tightness or constriction that opens up the body's
Hmm.
potential to self-heal. So my hope
Yep.
is that some of the folks that you're working with will be open to that and can find doctors that are open to that. And if they can't,
Yep.
I'm happy to talk with doctors they know or functional medicine practitioner I know who's licensed in other states. We can try to find some way to coordinate and help them.
Yeah. I am really, really excited about this and plan to be doing some work with yoga and ketamine, because there's enough people on it now that are
Yes.
prescribed lozenges or, the spray powder for depression, things like that. And so I really, really want to start gaining access to being able to research specifically yin yoga and ketamine. Um, but in your practice, how much do you think that because I believe this felt sense of safety and the fact that ketamine can help us access that and kind of help the nervous system relax a little bit, how much do you think that your or anyone's therapeutic support is actually part of the process?
It's huge. I think it's a
Hmm.
huge part of the process. So what we're seeing some studies coming out now about are what's called ketamine assisted psychotherapy, which
Hmm.
is talk therapy while people are using ketamine. And the nice thing about ketamine is when it's used sublingually, there can be some acute or immediate effects, which people describe differently. Some people describe feeling a little bit tipsy, like they've had a glass of wine. One of my
Yeah.
patients said she felt like she was on a cruise ship for a little bit, kind of rocking back and forth. It's generally considered very pleasant as long as people
Hmm.
aren't too active. Some people that get too active can feel a little queasy, so they have to calm down. But it's
Yeah.
ideal for use in a yoga session or a somatic bodywork
Hmm.
session or even a psychotherapy session. So I think that again, it can enhance they can enhance each other, the work. I think
Yeah.
I got off on a tangent.
I
Did that answer
absolutely,
your
no, I
question?
absolutely agree. I think that having, plant medicines, any kind of medicines like this that are state altering things are, it's hard to study them. That's why it's, so hard to start developing models to legitimize this practice so that somatic facilitators like, my students can begin working with ketamine and plant medicines, but it's coming. I'm
Yes.
excited for it, but it's hard to study and it's hard to create systems for, because it's not about the medicine itself so often. It's about the
Right.
experience the person's having within it.
Yes.
And when you have a person in your space and as a guide or as like just a resource that you truly trust, and hopefully that's actually had experiences with these medicines and knows what the
Yes.
experience is like and how to lead them through it, it just is so much safer. And
Yes.
it's unfortunate that, like, for so long, the only people that could work with psilocybin were doctors that were not the kind of people doing mushrooms, through their 20s. They had no
Right.
experience with anything like that, and so they don't know what it's like from the inside out.
Absolutely. And I think, it's really useful for practitioners, providers to have the experience themselves because it's
Yeah.
very powerful and you can't just describe it. Also, they
Mhm.
used to talk back in the 60s about the importance of set and setting, meaning that the
Mhm.
mindset you go into the experience with and the physical environment are crucial. It's like, as you said, it's not just the medicine, it's the whole
Mhm.
experience. And I think, yes, if they're working with a provider that they trust, that they feel safe with, both the
Mhm.
physical environment and then the relationship, they're much more likely to have a positive experience and get more out of the experience than if they
Mhm.
don't.
Absolutely. Okay, we have a couple more questions. We're
Okay.
already at 30 minutes, but I'm down to keep going if you are.
I'm fine if you are.
Any studies to show the success rate for, like, where can people find studies about the success rate for mental health, like PTSD and depression? Is there a resource that you use often besides the chat you have going with Jordan and Dr. James Prickett?
Yes, you can go on Google Scholar and just
Mhm.
search as for studies. You could put in,
Yep.
any topic you want, PTSD and ketamine, see what's
Mhm.
out there. It's amazing how many studies are out there. So that's one good way to do it. If that doesn't work, you can just
Mhm.
do Google. That's another one. There are other search engines, but I would start with Google
Uh-huh.
Scholar.
And pro tip for people that love to go on research binges, so all my ADHDers out there, which there's a ton in my audience, is if you go to Google Scholars, I often try to look for studies that were done through different colleges, and like, look for the legitimate people, look for the people that are names in the field. And then a lot of the studies have a lot of medical jargon. It is really hard to understand some of what they're saying, but if you go to ChatGPT and get a paragraph and be like, put this at a 12th grade reading level, explain this to me in a way I can understand, then it just interprets it for you, which is so
Brilliant.
beautiful. And it's, oh my gosh, it's helped me out so much with all the research that I do. So that's a pro tip for anybody that wants to do their own research. But I'm happy to also link articles that I think, the audience would be interested in under here. I just wondered if you had a specific resource.
Yeah. I mean, there's also PubMed, but that's a little bit more difficult. It's not for the layperson typically, but yes, and
Mm-hmm.
also if I can be a resource to people, I'm happy to. If they want to email me, I'm happy to share information that I have found with them as well.
Mm-hmm. Um, this next question is interesting because this person, I'm just going to read it verbatim. She's like, I'm interested in everything. I would like to learn about the regimens to treat everything from Parkinson's to depression, nerve pain, OCD. So maybe we can talk about the regimens. But then she says, as well as if can and should be tested for impurities, especially fentanyl. Are there different qualities, and is it available over the counter in Mexico? And I can answer one part of this question, which is that if you're getting medical ketamine, there's no chance that there's going to be fentanyl in it. If you're getting recreational ketamine, there are test kits that you can get from a company called Dance Safe. They often set up stands at parties and festivals and things like that, but you can order test kits for fentanyl that can test all kinds of substances and just make sure that they're pure and safe. But do you have anything to say about its availability in Mexico, or like different qualities used in the medical field?
Sure. So I don't know about its availability in Mexico. I haven't checked into that. I mean,
Mm-hmm.
I'm sure it's available medicinally. It's approved as a medicine all
Mm-hmm.
over the world. So I would expect it would be available, but I don't know from personal experience. In terms of its safety or purity, it is a FDA regulated medicine. And so it does have to go through quality testing, and it is
Mm-hmm.
obtained by pharmacists from reputable companies. Now, the one
Mm-hmm.
thing I'd say about the way we're using it, when you use it sublingually, we have to get it from what's called a compounding pharmacy. The pharmaceutical companies don't make it this way. The pharmaceutical companies don't make a lot of money off this, so they're not real invested in trying to help us with research
That's
or
why it's
make it
so
more
cheap.
available.
Yeah.
That's why it's so cheap. Yep, exactly. So, but we have a wonderful, actually, where we are in Colorado, there are several compounding pharmacies in Denver, Colorado Springs, Castle Rock that will make it for patients. And some of them are
Mm-hmm.
licensed to ship it to other states. So if somebody's living in another state and they have a doctor who will prescribe
Mm-hmm.
it, if they can't get it there, they can check with the pharmacy here and they may be able to ship it to them. So again, if you get medicinal grade, it's very, very safe.
Mm-hmm. If a person is interested in potentially following that route and curious about getting on a sublingual regimen of ketamine, there's a lot of doctors out there and psychologists and psychiatrists that would be very, very reticent to give the person a prescription for that, because there's a lot of
Right,
mistrust in it. How could the
right.
person approach a conversation with their doctor about this?
Yeah, this is one of the biggest problems we're having is
Mm-hmm.
physicians as a group are not very open-minded about this yet. And part of it's because they've heard a lot of the news stories about the dangers
Mm-hmm.
of ketamine, which are really overblown. Ketamine is a
Yeah.
very safe medicine. It's really difficult to get into trouble with it. It can happen. I mean, a
Mm-hmm.
classic example is the unfortunate death of Matthew Perry recently. It
Mm-hmm.
was splashed all over the news that he died after taking ketamine. The stories were not very well written. In that, what I mean is, I actually read his autopsy that was online, and he did not die from ketamine. He died from drowning, but he had taken ketamine apparently at a
Mm-hmm.
very high dose. The report said that he was getting therapeutic IV ketamine for treatment of depression, but the level in his bloodstream at the time he died was way above that. So apparently he was likely using it recreationally is the theory. And he took way too much and fell asleep and passed out and drowned. So there are situations where ketamine can be dangerous if you don't use it wisely. Even where we live here near Colorado Springs, there was a death when a paramedic overdosed someone because they didn't look at the dose. So you can get too much ketamine as anything. You can die from drinking too much water. So it is important to be careful of the dose. So back to the question, in terms of if the physician isn't open to it or aware of it, there are several approaches they can take. They can look for a physician somewhere else that is open and see if they can prescribe them. I'm happy to talk to any doctor that wants to learn about this and give them studies. I talked to a colleague here, a neurologist, who initially was somewhat skeptical. I told him about it. He said, Mitch, show me the studies. I sent him the studies. He says, this looks like it should work. I'm going to try it. He began trying it with his patient. He said, Mitch, it's working wonderfully. He's now writing papers with us. He said, the problem now, though, is when he talks to his colleagues in the field, other neurologists, they're not open to it. He said, in fact, he said, if he tried to present this like at a national conference, they'd probably throw him out because they just don't understand it yet. So we're working hard to try to educate physicians and get them up to speed.
There's going to be a tipping point about it. You know, that's how these things work in the culture, and especially the medical industry is just very guarded. And so there's going to be a point where enough people are informed and enough people are educated. And that's the thing, is if the doctors are not educated, as when they get asked for it again and again, and when we can actually inform the general public about this is how you find the studies, even bringing those to your doctor and connecting them with other doctors that actually are working in the field and can do it, like that's how that happens. Just a little bit slower.
Right, exactly. You're exactly right, Cara. Yes.
Yep. And I just had a really funny thought, but it's not appropriate enough to share here. Okay, so the last question I have here is, can you tell us anything about the percentages of success rates depending on like different kind of mental illnesses or physical things? Like, what is ketamine the best at treating?
Excellent question. So we have some early preliminary data on that that we actually presented last year at the World Psychiatric Congress in Vienna, Austria. We looked at the first 49 patients I treated with ketamine just to see how they responded. And what we saw was a greater than 90% response rate, and which was just amazing. You know, the typical response rate with conventional antidepressants is maybe 60%, 60 to 65%. So to get a 90% improvement was remarkable. And what we're seeing is, you know, we haven't done studies to analyze this yet, but I'm seeing similar. And when I talked to my colleague, Dr. Rachel Wilkinson, who's now been doing this for 4 years, I said, what kind of efficacy are you seeing for depression? She says about 90%. So we're seeing similar results. In other conditions, it varies, and there are a lot of variables. There are a few things that can affect ketamine. For example, if people drink too much alcohol, it interferes with ketamine. It's not as effective. I had one gentleman I was treating who went from severe depression to no depression on ketamine, was doing great. Then when he came back in, he was depressed again. I said, has anything changed? He said, no. I said, any lifestyle changes? He said, well, I'm having a few beers at night. And I said, how many's a few? He said, about 3 to 6. So I said, can you cut back? He said, sure. He came back the next time. His depression was gone. He said, I stopped drinking. I didn't need it. So response rate also varies with other factors. And so, but I think in terms of psychiatric diagnoses, so far, depression, anxiety conditions, ADHD, OCD, even PTSD, I'd say we're seeing somewhere in the 80 to 90% response range. And again, it's very slow though, I should mention, it's not a fast treatment. It's not something where people start the medicine a week later feel better. It often takes a month to several months for people to notice the benefits, and they're very subtle. A lot of people would come in and say, I don't feel any different, but I was doing depression rating scales before they started and after, something called a PHQ-9, and people would come back and say, I don't feel any better. And I'd say, well, that's interesting because your rating scale shows you're 50% better from what you've told me. And so people say, well, I guess so. So now I tell people, it's like watching your own hair grow. You know, from day to day or week to week, you don't see any difference, but over months you can see a difference. So expect that with the response to ketamine with this low dose. It's going to be very slow. But again, I'd say as a general figure, somewhere in the 80 to 90% range is what we're seeing for most people.
And that's for depression?
That's for depression. No, it's pretty, right now, it's pretty general. It's unipolar depression.
Anxiety.
Anxiety, PTSD, ADHD, OCD. We're seeing pretty good results across the board, which is what makes it so exciting.
That's incredible.
Yes, I know. It was unbelievable to me in the beginning. I didn't believe it. In fact, I got in the habit. Poor Dr. Wilkinson, my colleague who had been doing this longer, and when I first started prescribing, patients would come back and they were so much better. I'd text her in the middle of the day and I'd say, Rachel, you're not going to believe this. This person's 50% better already. And she would text me back and say, Mitch, calm down. It's going to get better. And so my patient would come back a month or two later and they were 75% improved. I'd text her again in the middle of the day. I'd be so excited, Rachel, you won't believe this. This person's 75% better. She'd text me back in, Mitch, calm down. It's going to get better. I said, how can it get any better? She said, give it another month or two. People will be in remission. Their depression will be gone. And they'd come back a month or two later, and many of these people were in remission. Their depression was gone. And I texted her back. I said, I apologize for doubting you. I didn't expect this was going to happen. And she's so kind. She wrote back and said, Mitch, don't worry about it. I didn't believe it in the beginning either. She said, I didn't expect this much of a response. It was beyond my expectations. So now we're getting together, she and I and other providers that are using ketamine, prescribing it, so we can share information and discuss it to try to help each other and learn from each other.
Yes. Oh, I love it so much.
It's so much fun. I have to tell you, I've been doing this for 38 years as a psychiatrist. I have never had so much fun as a psychiatrist because I get to see people getting better. And there's something else I have to mention here that I didn't expect. And that is, I started seeing after people have been on their medicine 6 to 12 months, some of the people started coming in and say, oh, I stopped my medication, my other medicine, my antidepressants. I said, you what? I stopped my medicines. I said, are you okay? They said, I'm fine. So I called Dr. Wilkinson up. I said, are you seeing people get off their medicines after a while? She said, oh, almost it's the norm. After a period of time, most people don't need their conventional antidepressants or anti-anxiety, their ADHD medicines, they can get off. And so now what we're seeing is, people are able to replace their conventional psychotropic medicines with ketamine. And then the exciting part, Kyra, is she's telling me that after about 3 years, a lot of people don't even need ketamine anymore.
That's what I was just about to ask.
It's as if they've healed their nervous system, she says. They kind of taper themselves off and they feel great without any medicine. Now that is really exciting to me. That's the most exciting.
That is the most exciting, because what we want is to be able to support the body to get to a level of health and regulation that it can maintain. And that's what's so wonderful about the nervous system and about my work with depression and anxiety in working directly with the nervous system, is that I tell people, you know, if you're living in a way that is a little bit stuck in the sympathetic nervous system most of the time, or a little bit stuck in the parasympathetic nervous system, both of those things come with their own host of complications, but either way can cause all sorts of health issues and chronic pain and mental disorders and all the things. But when you can kick the system into gear and get it into the regulated state, it's more likely to stay there. I tell my students that it's like a defibrillator with the heart, where it's like you do it once and then the heart starts pulsing again.
Yes.
And when it's not always like that, because things happen in our lives that throw us off and that upset us, and we get dysregulated again. And so giving people the tools in the system to come back to regulation when they need to, and to eventually not have to rely on other medicines as well.
Yes.
That's the goal.
And Kyra, there's two things I want to say to you about that. One is the concept of homeostasis, that we have, balances in our system, and that could be chemical, electrical, psychological balances. And if we get out of that homeostasis, it causes disease. And I think what the ketamine is doing is helping restore homeostasis. The second thing, if I can do this, I want to show you a picture of a dose response curve with low dose ketamine. Oops, there we go.
Absolutely.
This is what we're seeing with ketamine. It's really fascinating. Let me see. So at this side, if we go from low dose to high dose ketamine, we see low response to higher response. Whoops. But the interesting thing is that at very low doses, ketamine doesn't help. And then if we get to a therapeutic dose, it starts to kick in. And if we go to a little higher dose, we get more response. But if we go too high on ketamine, we start losing benefits. And if we go way out here with a really high dose, it stops working altogether. And so what we found is that sometimes less is better. And so I tell my patients, you don't, because you feel better at one dose, doesn't mean doubling the dose is going to make you feel twice as good. So we're going very slowly and cautiously, which I like that approach much better anyway. And people find out if they go too high, they don't feel as good. They start feeling more anxious, more irritable. They have insomnia, racing thoughts. And if we reduce their dose, they feel better. So I just want to point that out, because some people think more is always better. And it's not. It's about, again, homeostasis or balance. It's not just with ketamine, but with life, as you were talking about.
Yeah. With plant medicines, there's so many different, I used to have just an understanding of what kinds of plant medicines were good for which things. There are some people that want to explore ketamine or psilocybin or DMT or ayahuasca or ibogaine because they are looking for just something novel. and exciting, and they want to explore. And I think that that's looked down on by a lot of people, especially that are like trying to further the psychedelic movement because of the potential mental health benefits and physical benefits. But it's like, that is just as important to the human experience, and it's just as valuable. And
Yes.
ketamine could of course be used for that. Lovely, amazing. But it also can be used in all of these other ways. And it's, again, not about the medicine, but your relationship to it. And so if that is something that you're interested in ketamine for, is like that crazy experience, you might consider going to an ayahuasca retreat center, or to work with a shaman with a peyote, or what I don't remember the other one, Wachuma.
Oh, there's so many.
Yeah, there's so many.
Yes.
There's so many to explore. And so if you want to
Right.
explore, that's not lesser than, and it's not, you don't have to pretend that you want to like deal with something medically because you want to have that experience. There's lots of different things that you can approach that way with, but there's so many people struggling from depression and anxiety, and all they're looking for is relief. And like, I want this to
Right.
be available to the general public for that.
Yeah, so you make an
Mhm.
excellent point. In our Western medical model, it's a disease-focused model. It's
Mhm.
about diagnosing disease and treating disease. It's not about health.
Mhm.
It's more of a disease model. But these medicines, these plant medicines, have enormous potential to do other
Yeah.
things beyond just relieve disease. For
Mhm.
example, we are looking at the ability of ketamine and other psychedelics to enhance creativity. And there's lots
Yeah.
of evidence out there that they definitely enhance creativity through a variety of different ways. And
Mhm.
on Jordan's website, we'll be posting some educational videos about this in the near future.
Yeah, I
Um,
was gonna say we can link that when it's out into the YouTube and underneath the live that we're doing in my group, because I would love to have my students have access to that.
yes, the only other thing I'd say
Yeah.
about that, Kyra, I agree with you that sometimes the way to access these is to work with a reputable shaman who has
Mhm.
experience with these. But people
Yes.
do need to be careful. I had a friend who went to Peru
Mhm.
to experience ayahuasca for the first time and found a shaman who was not reputable but administered
Mm.
ayahuasca cheaply and had a very
Mhm.
bad experience. So people
Yeah.
just want to be very careful that they find someone reputable that they
Mhm.
work with. And then it can be a powerful, amazing, life-changing experience for many people.
Yep. And if you're finding this and you want to know a little bit more about how to find a reputable shaman, I'm happy to come into the Facebook group that I have and ask your questions there. I have a lot of great advice for people that are seeking, because I completely agree. If you are dead set on exploring psychedelics and you don't want to pay for a guide, so low and slow, begin to get a relationship with understanding what that means. Make sure you're in a safe environment, make sure you're with safe people. But ultimately, I think the way to go is to find a guide that actually really you feel deeply, deeply safe with. They have a great reputation. And I would also offer that there's a lot of people, as psychedelics get legalized, and there's facilitator trainings and things like that, it's going to be less common that you find these kind of just like underground facilitators. But there's a lot of underground facilitators that are working with all of these different plant medicines, and some of them are very talented facilitators, but they don't have a great balance in their mental health, don't have good relationships, have a terrible relationship with their body. And I really feel like if you're going to work with medicines that take you to such altered states of consciousness, be with a guide that can also be grounded in this reality and also create a beautiful life for themselves, vocationally, relationally, and physically. And that's what we heal for in the first place. That's what we explore for in the first place, is because we're looking for fulfillment and happiness and health. And we're not just healing to get on this hamster wheel of trying to fix ourselves all the time. We're healing so we can thrive. And so work with people that also have lives that are thriving and practices that are thriving, you know?
Absolutely. Thank you.
Hmm.
Yes. It's really
Yeah.
not about just the removal of disease. It's about thriving and health and
Hmm.
happiness. Yes. And ultimately, that's where we want to get to. Yes.
Yeah. I love
Good.
it. I think that's a good place to end this. And I just cannot thank you enough for you just agreed like so quickly to come on. And I'm just so, so grateful to share you with my people.
Well, thanks for the invite. This was a lot of fun. So I
Yeah,
really appreciate the invite. So thank you.
same. I'll give you a text afterwards so we can like come off the call. But thank you so much, Mitch. And anybody that has
You're
any
welcome.
questions for Mitch, how can they reach out to you or find your work?
Sure. So I can give out my email address is probably the easiest way to get me.
Hmm.
I don't have a website. It's dr.liester@proton.me. So I'll spell that
Hmm.
dr.lie. Yes.
I can just put it underneath the
STER.
show notes and
Ah,
everything.
thank
I'll
you.
link it in
That's
there. And
easier.
I'll also, you have some different resources of presentations that you've done online. So I'll just link all the things, including some studies that I think would be really helpful. And again, just thank you so much for coming on.
You're welcome. My pleasure.
Okay. Talk to you
Okay.
soon.
See you. Bye-bye.